Time now to turn to Carl Deninger of market-ticker.org, who has a solution, he believes, to what ails America's healthcare system. Carl, welcome back. What do you got?
Oh, I have a lot of things, but let's just start with enforcing existing laws. There is a body of law that's been around for over 100 years. It's 15 United States Code, Chapter 1, known colloquially as the Sherman, Clayton, and Robinson-Patman Acts. They were passed after the infamous robber baron incidents in the late 1800s, where you had cartels in various industries that were essentially ripping off the consumer to ridiculous degrees. And so Congress passed these laws that says basically attempting to monopolize a restrained trade is illegal. And if you get caught doing it for a corporation, it's a $100 million fine. And for a person, you get to go to jail. And you get to go to jail for a long time. It's a federal felony. So it's 10 years in the can for the executives and a $100 million fine per count for a corporation. Of course, $100 million per person that gets screwed is enough to put any company out of business. And that's the idea, is it's supposed to be enough to put any company out of business. So if you were to apply that and remove the few protections that do exist that have been granted by the Congress, we'd essentially solve the problem. As just one example, there was a recent article that was flying around about the terrible conundrum facing this attorney who is currently self-employed and has MS, and the drug to control it costs $70,000 a year. Well, if he goes to work for somebody, that $70,000 has to come out of everybody else's hide that works in the company, because that cost is going to end up going on that employer's health insurance. But the part that wasn't talked about is that if you go into Canada or England, that drug is available a year's supply for $500. So, I mean, $500 he could pay out of his pocket. He's a lawyer, for crying out loud.
Right. So you have basically monopolists that are rentiers, that are exploiting the system, that are bypassing the law, that are being enabled by politicians in Washington, and folks can't really push back because illness is something you can't outsource. You're ill. You have to go to the hospital. So, enforce the rule of law. But we don't see the law being enforced in many places in America. I mean, you're talking about healthcare providers, healthcare companies, pharmaceuticals that are violating Sherman antitrust laws. And, but law breaking seems to be the national pastime in America. Just ask Goldman Sachs and JP Morgan. It's eclipsed baseball, really, is what Americans do. So how are you going to get around that, Carl?
We have to get around it, Max. Healthcare as a percentage of our economy has gone from 3 to 4% of GDP in the 1950s and 1960s to almost 20% today. It's expanding on the federal budget balance sheet between Medicare and Medicaid at 9% a year, and has been for the last 30 years. It's expanding in the private sector most years by double digits. So you're seeing, 10, 12, 15% increases. I was seeing this in the 1990s with our health plan at MCSNet, and it's still going on. So, you can do the math on this any way you want. It's going to destroy the country if we don't stop it. So I understand that this is, this kind of lawlessness is sort of the way that America's evolved into and what we've become. But there comes a point at which the people of this country need to stand up and say, okay, look, we solve this problem, or you're going to end up broke, sick, and dead. And whether you're ill today or not, that's the fate you're going to face unless we put a stop to this.
Right. Now, you mentioned, of course, that in Canada they're paying $500 for something that would here might cost $70,000. Of course, in Canada you have the single-payer system of healthcare. Is that the solution, Carl?
No, because, look, what you have had happen is that as countries have put such systems in place, they have done nothing to address the monopoly of care in other places than drugs. And so while this looks fine, what it's done is shove the cost off on America. Well, consider this. What happens if we collapse that? Then their costs will go up. So, there's 330 million Americans roughly, and what, 6-7 billion people in the world? How many are in the industrialized world? Well, several times our number, right? So if you take our cost and collapse it by 90%, what do you think happens to theirs?
Right. Well, just from a personal anecdote, we pay close to $20,000 a year for health insurance, not health care. And the state of North Carolina wants to bump that up by more than 20%. And yet doctors aren't being hired. What we see are increase in bureaucrats and bureaucracy and salary increases and CEOs of these companies making $50, $60 million a year. So this is a real predator-prey situation. They treat folks who are needing of health care like the Hunger Games, like they should be hunted down and killed for the pelt. I mean, it's beyond just irresponsible and predatory and monopolistic. It's downright evil.
It gets worse than that, Max. There's, when you think about what's going on right now, if you look at the growth in employment in the BLS tables and the employment numbers, last month about $800 million worth of administrators that do not provide 1 minute of care to anybody were permanently added to the healthcare system that we all pay for in the United States. The number of doctors has not gone up all that much over the last 20 years. The number of administrators has gone up at several multiples of that. Those people provide zero in the way of actual care to real people, but they all extract a salary. And so, you say, well, it's $800 million. Yeah, $800 million this month, next month, the month after that, and it compounds. So we have to stop this. The other thing that you look at, if you look at the health insurance companies, if you really want to have your wig peeled back, look at the G&A line in their balance sheets, the inefficiency. They spend about 20% of their income, their revenue, on G&A. Amazon spends 2%. Now, how do you get away with 20% in a competitive market when other people can undercut you? You can't. But if you have a monopolist market where you can charge whatever you want, well, then I can hire all these people that don't do anything and I can charge it off to G&A.
Right. Well, I mean, it sounds eerily similar to the prison business in America. That is also turned into what's called the prison industrial complex, where you've got private prison operators embedded with municipalities guaranteeing occupancy rates or going out and locking people up for minor infractions or for no infractions, just as a way to keep that paycheck coming along. So is that a fair comparison, Carl?
I don't know, Max, if that's a real fair comparison or not, but I will give you one that is, which is that, you basically alluded to creating crimes when there aren't enough criminals, right? And there's a similar problem that goes on to some degree in healthcare. The exact scope of it is hard to determine, but I'll give you just one example of this. There was a study that came out earlier this year that showed that for people who are ordinarily healthy, taking a statin doubled their risk of diabetes, but did not provide any protection against heart attacks. Well, if you contract diabetes, and by the way, this is not an insignificant percentage either. Your risk went from about 6% to about 14%. So if you contract diabetes, you are then going to be drug dependent forever, according to the medical literature and according to the so-called standard of care. And oh, by the way, the path of that disease inevitably leads to amputations, blindness, and dialysis, after which you die. But in the meantime, you've thrown $500,000 or more into the medical system that didn't have to be spent. And the ugly part of this is that between Medicare and Medicaid alone in our country, our government spends somewhere between $300 and $400 billion a year on this disease. And it appears that a substantial percentage of these cases are actually being created by the medical system on purpose.
In the old days, you walk down Main Street, you'd see a sign in front of the barber. He'll pull your tooth for $5. And that was the price. That was the service. As a matter of fact, the red swirling barber pole is from the blood coming down the, from tooth extractions on the white sheet that they give you there. So isn't some transparency needed in this market? I mean, they're operating completely obfuscating everything. The cost of administration, they don't tell you what the cost is for their health care that they're providing. They don't tell you that there's, the same drug can be bought by 1/1000th of the cost somewhere else. They're operating in complete shadows. What about some openness here, Carl?
Well, that's the entire answer right there, Max. I mean, there's no other business in this country where you could get away with what they do every single day in a hospital or in a doctor's office. If you tried to tell people that you weren't going to tell them how much gasoline cost at the gas station until after they pumped it, and then the price that they paid, depending on what kind of auto insurance you had, the people that ran that gas station would sell zero gasoline. And if they all got together in town and tried to do it, they'd all go to jail. They'd be locked up within an afternoon. So, these are all practices that are quite clearly illegal under both federal and state law. And, not only the Sherman-Clayton Act, but the consumer protection statutes, both at the federal and state level, essentially consider this sort of thing a deceptive practice. But nobody will go after anybody about it. You can call up your state attorney general. They'll tell you point blank, we won't touch that. I have a friend of mine who had that kind of thing happen, where she was actually billed for procedures that were never performed on her kid, and she tried to file a complaint with the Attorney General of the state, and they said, we don't handle those.
Well, it's a growing, sprawling nightmare that there's no rule of law. These folks are getting fabulously wealthy and predatory model of making people sick and then capitalizing on. It's the economics of extinction. It's like, fishing the seas to extinction to make a few bucks. The healthcare industry is killing as many Americans as possible for a quick buck, thinking, forgetting that they would need living individuals in 20 years to continue their industry. They're willing to flush it down the toilet today for a quick buck, Carl.
Yeah, that's basically what's going on. And the thing is that extractive models like this, though, Max, run until somebody puts their foot down. The problem is it's strangling economic growth. Because if you're a business person, are you going to expand your business and trigger one of those thresholds where you have to provide health insurance or pay a fine? Or are you even going to hire the first possible person where you would provide health care? It was hard to make the argument that it made sense in the 1990s. Today, it's insane. You have to be flatly out of your mind to do anything that exposes you to this.
Right. As you pointed out, this has an ancillary impact on small businesses that are unable to actually create businesses and the new jobs that go with it. All right. Well, Carl, thanks for being on Summer Solutions.
Hey, thank you for having me.
All righty. Well, it's time to say goodbye.